would like to mention, or anything else?
I have to thank Laura.
Yes. Thank you so much.
But for you,
thank you so much.
Is my pleasure.
We greatly appreciate your contribution.
Thank you so much, Professor.
In the conference. Thanks.
Thank you. Hope to see you again.
It's our pleasure.
Have a lovely day. Thank you.
Have
Bye.
a great day ahead.
Thank you. Right.
Thank you.
Our next speaker.
Yes.
Who is our next speaker?
So now I would like to give the floor to Dr. Elda Dolia from Business Administration Department, Faculty of Economy, University of Corcha, to give her speech on the risks posed by COVID-19 to the healthcare industry and the case of Tirana Retina Institute. Dear
Hello
Elda,
to everyone.
can you hear me?
Right.
Hi.
Yeah.
Hello.
Do you hear me? Hello to everyone.
Hello, doctor. How are you?
I'm fine, thank you.
It's really nice.
My name is Elda. I am a lecturer at the same university as Professor Tirana, University of Corcha. I teach management, the Department of Management. And first of all, I want to congratulate you for organizing the conference. Thank you for inviting me to be the invited speaker.
It's our pleasure.
In this conference.
Elda, you can share the screen.
Second to share. Yes, I saw it.
Yeah.
Yes. Okay.
Perfect.
Thank you for inviting me. And today I'm going to present, my presentation is about the risks posed by, general risks, in fact, caused to the healthcare industry and special risks caused by COVID-19. And my case study is Tirana Retina Institute. It is an eye clinic situated in Corcha, in Albania. In fact, I am the general manager in this eye clinic. That's why I teach risk management, and I've done the risk management of this eye clinic. According to the Oxford English Dictionary, risk is defined as a chance or possibility of danger, loss, injury, or other adverse consequences. So in this context, risk is used to signify negative consequences. And the Institute of Risk Management defines risk as the combination of the probability of an event and its consequences. In fact, recent events in the world have brought risk into a higher profile. Terrorism, extreme weather events, global financial crisis, and the recently pandemic COVID-19 represent the extreme risks that the society and businesses are facing today. And these have brought risk into a higher profile. Risk management, according to the Institute of Risk Management and the ISO standard, is defined as the systematic process which aims to help organizations to identify, evaluate, and respond on all their risks in order to increase the probability of success and reduce the likelihood of failure. In fact, the activities related to risk management have been in place for decades, but without the specific name of risk management. One of the early development of risk management emerged in the United States out of the insurance management functions. The concept of risk management has been used in banking and insurance services and in hospitals in the USA since the early 1970s. Risk management in healthcare comprises the clinical and administrative systems, processes, and reports employed to detect, monitor, assess, mitigate, and prevent risks. In healthcare organizations, risk management consists of proactively and systematically safeguard patients' safety, as well as the organization's assets, market share, accreditation, reimbursement levels, brand value, and community standarding. Is it okay, or do I have to press the presentation?
F5?
It's better like this, I think.
You can do
If you
F5 if this is
can
okay.
click, yeah, on F5.
On your keyboard,
Yeah.
you can do F5, Doctor, if
Yes,
this
yes,
is
yes,
okay.
I did it. Is it okay now?
No, we still
Um,
can't see
It's
We
not full
can't see
screen.
it at the moment.
it.
Okay, because it is activated to me, the full screen.
Right, I
Oh,
see.
okay.
Maybe it will come later.
Later, yes, of course.
Mhm.
Okay. Now, my case study is Tirana Retina Institute, limited liability company. It is an ophthalmological clinic situated, in fact, in 3 different cities in Albania. Its first branch was opened in the city of Korça in May 2016, so it is a 5-year-old clinic. And its mission is the excellence for eye care. It is specialized in eye visits, injections, and surgeries such as cataract, glaucoma, etc. The staff is composed of 2 doctors, a surgeon, ophthalmologist, and anesthesiologist, 3 nurses, 1 receptionist, 1 economist, 1 manager, 1 assistant manager, and 1 psychologist. The process of risk management, as I mentioned before, is composed of 3 important processes. The first process is the risk identification. So it is the most important at the beginning of the process of risk management to identify the most important risks of that the clinic is facing. The general manager combines top-down and bottom-up methods in order to identify and to the other processes of risk management. The manager continually identifies the risks for
I'm
each
really sorry.
category. Yes.
May I say something? I'm not sure whether you switched between the slides or not, but we are still on healthcare risk management. Okay, yeah, now that's fine.
Okay. Is it okay now?
Yes, thank you.
Okay. Okay, maybe it's better in this stage. Okay. The first process of risk identification is based on on a model proposed by the American Society of Healthcare in Risk Management, which gives us a good model to classify the risks into categories. We, the staff, me as the manager and the other part of the staff, continually discuss the different problems happening in the clinic using the different tools, such as the tools for analyzing past events, the tools to collect opinions, interviews with the staff and group meetings, and the tools to analyze operations happening in the clinic. The model proposed by the American Society for Healthcare Risk Management divides the risks into 8 categories, 8 main domains, which are operational risks, clinical and safety and patient safety, strategic risks, financial, human capital, legal and regulatory, technology, and hazard risks. In the new CAM of COVID-19, it is we have added another domain, another category, which are the risks brought by the virus COVID-19. So we systematically identify even the risks caused by this pandemic. These are the definitions for each category of risk, and the management staff continually tries to identify the risks for each category, for each domain. So we continually discuss about the operational risks, which are risk related to relate to risks resulting from inadequate or failed internal processes, people or systems that affect business operations. And such risks are adverse event management, credentialing and staffing, documentation, chain of command, and deviation from practice. So we continually discuss and share opinions about the possible risks for each category. Clinical and patient safety risks are associated with the delivery of care to residents, patients, and other healthcare customers. Clinical risks include failure to follow evidence-based practice, medication errors, hospital-acquired conditions, serious safety events, etc. The strategic risks are associated with the focus and direction of the organization, managed care relationships or partnerships, conflict of interest, marketing and sales, media relations, mergers, acquisitions, joint ventures, etc. Financial risks include costs associated with the malpractice, the litigation and insurance, capital structure, credit and interest, etc. Human capital risks refer to the organization's workforce. Included are risks associated with employee selection, retention, turnover, staffing, on-job work-related injustice for workers' compensation, work schedules and fatigue, productivity and compensation, and so on. Legal and regulatory risks are related to the failure to identify, manage, and monitor legal, regulatory, and statutory mandates on local, state, and federal level. And such risks are generally associated with fraud and abuse, licensure, accreditation, product liability, management liability, etc. Technological risks healthcare nowadays have seen an explosion in the use of technology for clinical diagnosis and treatment, training and education, information storage and retrieval, and asset preservation, social networking, and cyber liability. Hazard risks covers assets and their value related to nature exposure and business interruption, facility management, plant age, etc. And the recently COVID-19 risks are related to staff and patients' possible infection, and the implementation and compliance with the COVID-19 standards and rules. After we identify the risks for each category, the second step of our work is to assess the risks. In fact, there are two types of assessments: qualitative and quantitative assessment. Qualitative assessment relates to the different characteristics of the risk, and the quantitative assessment, which is the most important assessment, deals with two important elements: the probability or the likelihood of happening for each risk, which vary according to our evaluation. varies from 1, very low, so the probability of happening is very low, to 5, which is the highest level of happening. It is quite sure that the risk is going to happen to the clinic. And the second element is the damage caused to the clinic if that risk happens. And it ranges, its score ranges from 1 very low, so the damage is very low caused by the risk, and to 5, which is the highest damage caused to the clinic. And these elements compose the expected value, which is the sum of the multiplication of the probability of risk occurrence with its possible damage. This expected value will have its scores vary from 1, which is the lowest score, to 25, which is the highest score. According to the value of this expected value, we rank the risks into the ABC analysis, according to which the A risks are the main important risks with the highest score of expected value, and their score range from 25, the highest score, to 16, the lowest score. So if the risk score is between 16 to 25, it is an A risk, which means it's a high category risk. B risks are of medium importance. Their score are 9 to 15. So it means that they have a medium probability of happening, and if they happen, they cause medium damages to the clinic. And C risks are the lowest ranking risks, which have the lowest expected value. It means that they have a low probability to happen, near to 0, and if they happen anyway, they cause the lowest damage to the clinic. This process of risk assessment is very important, and the output of this process is the input for the next step, to find the risk responses. We rank the risks from the highest to the lowest importance, and then it is important for us in the next stage, when we find the responses, to mitigate the risks, because we begin with to find responses to the highest risk, because they are the most they have the highest probability to happen, and they cause more damages to the clinic. They are of major impact. When we try to find the responses, there are there are different risks which threat the clinic. There are also different responses, but we have to take care and to be very careful when we find the responses, because each response must be effective, so it must be the right response to the risk, efficient. The risk response must have the lowest cost, because we may have different responses, but we have to choose the one which costs less. And the response must be in compliance with the laws and regulations, otherwise it can cause another risk too. And it is important that the risk response must be accepted by the staff management and the other support staff too. it must be easy to adapt the response. Then we choose the responses analyzing the different techniques, control techniques. For example, avoidance. We choose to avoid the risk. It is if it is low risk, so it has low probability to happen, and if it happens, it will cause less damage to the clinic. Prevention, reduction, segregation, or a non-insurance transfer. Or we can choose a financial technique to retain the risk for ourselves or to transfer the risk to the insurance companies. On these three main processes of risk management, identification, analyzing, and risk responses are put here to the risk register. This is a document called the risk register. And when we put all the characteristics of the risks, these are the main elements of the risk management. It is the number of risk. It is an ID for each risk, which is unique. So each risk has its unique ID number. The second is the risk description. What kind of risk is it? And then to which category, to which domain that risk belongs. The two elements of risk assessment, risk analyzing, are the probability and impact, which then give us the expected value according to which we rank the risks from the most important to the less important. And the last element is the risk response. What should we do to prevent that risk from damaging the clinic? In this slide, there are the A risks category. I told that they range from 16 to 25 points. And the most important risk because of the situation is the risk related to COVID-19 in this category. It is the risks of patients and staff infected with the virus. It is quite possible to happen. And if it happens, it has a great impact. That's why it is ranked as the first risk. The response to this risk is to implement correctly the COVID-19 protocols and rules in order to protect the patients and the staff. The second risk is the increased patients' needs requirements about the quality of care. So it is a clinical and patient safety risk. It is its ranking. It's in 5 points, and the possible response to this risk is to increase the staff quality of service. The third risk is the adequate protocols, controls, and policies. It is an operational risk. Its possible response is the staff training and continuous control of the implementation of the right protocols, controls, and policies. The fourth risk is the quality of care. It is it is related to patient safety. It is very important to always offer the excellence for the eye care. That's why it is an important risk. If it doesn't happen like this, the possible response is staff training and continuous control. Employee engagement. In nowadays, the most especially in service offering businesses, the employee engagement is very important
Hilda.
because, yes?
Dear Linda, I'm really sorry for interrupting you, but like we're short of time, so can you just wrap up in 3 minutes?
Okay.
Please? Then
Okay,
we can
okay.
take some questions for
Okay,
you.
these are the A risks. Then followed by in the next slide, B risks. So less important, and the less important C risks. In conclusion, I could say that it is in all this process of risk management, in every condition, it is very important to include in this process the participation of the staff using the bottom-up method. And this process is a very dynamic process, and it needs continuous review, evaluation, and monitoring of each process, identification, assessment, and risk response. We always do some questions to ourselves. Is this the correct process? Does it meet our current needs, and so on? And so it is very important to revise. The monitor is the last and most important process of risk management. Okay, that's all.
Thank you so much. Thank you for this insightful presentation.